deep concerns around the situation in care homes in England.
EU data suggests that care home residents account for around half of those killed by the virus.
The virus is just wiping people out, and it's really, really hard to watch.
It is a national scandal in Britain. Now around 1 in 3 daily COVID-19 deaths are in care homes alone. That is a massively high death rate compared to the rest of the population. And it's not just in the UK, it's a similar picture in many other European countries. Now, is this high death rate because care residents are elderly and vulnerable, or is it partly because governments made mistakes and perhaps society more broadly just doesn't care enough? We'll be posing those questions to our panel, including a care home manager who's taking drastic action to protect her residents, a doctor in Spain who's handled many emergency responses over the years, including earthquakes and famines. And we'll be hearing from one of Britain's most loved TV stars, Esther Rantzen. She founded a charity to help elderly people, and she's about to turn 80 herself. But first, let's look at how this care home crisis has affected not only the residents, but their families and the carers themselves.
He passed away on the 24th, 6 a.m. with no one near him. We weren't able to say goodbye to him. Seven people in one care home. That's a significant amount of people dying from COVID-19. It just doesn't seem right.
Care homes in Britain are being devastated by the COVID-19 outbreak.
The number of coronavirus deaths in nursing homes could be 5 times higher than the official estimates.
We do need more help with obviously PPE, getting those supplies to the front line. Testing is the key thing for us.
Without them, care providers say they are working in the dark, not knowing who has coronavirus and who hasn't.
We're just powerless. I've got no words.
I feel that they're sort of lambs to the slaughter, to be honest with you.
It's the most soul-destroying thing that I've ever experienced.
This virus is just wiping people out, and it's really, really hard to watch.
The people in care homes are the most vulnerable people in our society. They're weak, they're dependent on other people, their immunities are low, and yet they're just classed in this current crisis as pretty unimportant.
They should be the priority. They're the vulnerable people. They can't defend themselves.
Well, unfortunately, there are many similar examples around the United Kingdom. At the time of recording, 21,678 people have officially died from COVID-19 in the UK. The government only included deaths in hospitals in those figures. If you were to add deaths in care homes, the total toll is far higher, well over 25,000. And then there's a small minority of deaths at home or elsewhere. The number of deaths in care homes is incredible when you consider not even 1% of the UK's population live in such places. So to reiterate, a group that makes up less than 1% of the population already accounts for 14% of total COVID-19 deaths in the UK so far. And that proportion is only increasing. From mid-April, care homes accounted for 1 in 3 deaths. And experts say that deaths in care homes could soon overtake even hospitals. Now, why is this happening? Yes, of course, people in care homes tend to be the elderly or have pre-existing health issues, which makes them more vulnerable to COVID-19. But on top of that, mistakes have been made. One consultant geriatric doctor told us the main problem is that carers were not being tested.
The government had misplaced priorities. Testing, isolating should have been the mantra, which hasn't happened up till recently. So what should have happened is that they should have tested people in care homes, particularly the healthcare workers who are working closely with them, the residents, and isolated the people. If there were care workers who were positive, isolated them, or residents isolated them, that would have contained the problem. And also done the contact tracing. 3 things: testing, isolating, and contact tracing, which we haven't done on time.
Well, as you'd expect, the government has been criticised heavily for how it's handled the crisis, in particular the deaths in care homes. Here is the Minister of State for Care being questioned last week.
Is it true that 4,000 people... Why are you laughing?
I'm coming to ask your question, but I'm not...
What do you find funny about this?
I don't think it's funny in the slightest.
Well, why do you keep laughing then?
I'm not laughing at all.
I literally just asked you, is it true that 4,000 elderly people have died in hospital and all you can do is laugh? What's the matter with you?
OK, let's bring in Mike Padgham now. He's the chairman of the Independent Care Group, which represents a number of care homes in the north of the United Kingdom. Mike, thanks for joining us. I really appreciate it. We've heard several government ministers being admonished in the media for the apparent lack of care when it comes to care homes and a lack of attention. Do you feel let down by the government?
Well, sadly, I do, because we have over many years been saying that the social care sector in England has been underfunded and underrepresented. So this pandemic coming along has only shown the stark divide between the NHS and social care. So we do feel let down, but many governments going back probably 2 decades have always regarded social care as a Cinderella service.
You mentioned funding. Let's just quickly deal with that for our international audience. There have been people writing in the media who say, well, they are private care homes and therefore they should take care of their own preparations for PPE and for testing and so on. What's your answer to that?
Well, in fact, in the UK, then the majority of care homes are in the independent sector. That's quite right. Mainly private business. Some are charities, of course. But a lot of the care that we provide is on behalf of the public sector, because there are around 400,000 beds in England in social care. And in the main, of course, we do provide PPE ourselves and have no problem with that. What we found is even whilst we've been willing to pay for it, PPE hasn't been in short supply. So we have found the costs of providing the PPE has gone up, in my own experience, over 400% in just a few days. So that's a challenge for us. It's the costs is exceeding what we can actually afford.
And now we've heard from a consultant geriatric physician who said that the main problem was that the government didn't insist on testing carers and also residents. And that was the main reason why, apart from obviously the underlying vulnerability of these residents, but that was the main reason why we saw so many deaths and are going to see so many more deaths in care homes. Would you agree with that?
Yes, and I regret every death that there is in care homes. But I do remember, I can't remember, was the president or the chief executive of the World Health Organization said, testing, testing, testing at the beginning. Yep. And I'm sad that the government didn't take that advice. I'm no expert in a pandemic such as this, except to say the World Health Organization did speak with a lot of sense, and I wish that we had been able to test much earlier, and then I think we would have reduced the number of deaths. But I guess we are where we are now. Sadly, going forward, let's get the testing in place quickly, and let's reduce the deaths as much as we can going forward.
Well, that's what the government has pledged this week, that care home carers and residents will have access to testing. They're also going to change the way they add up their COVID-19 death tolls. They are going to start including death tolls from care homes during the period, which has been the entire period actually of the crisis, where they were not including deaths from care homes. What did you make of that?
Well, I was disappointed really, because I think it gave people a false sense of optimism, and I'm very glad deaths in hospital are reducing. But I'm sad to say, and I believe the figures will be reproduced later in care homes, is that we are going to see an increase in care homes before they flatten out and fall away again, sadly. And that is not right, but I'm glad they're including them now. Just going back to the testing in PPE, I'm pleased the government have announced they're going to change things, but words are easy to say. What we want to see is the tests and the PPE in the front line quickly, because we've been waiting a long time, and I want to make sure that they're as good as their word and they deliver to us soon.
Yeah, now we are soon going to be hearing from Claire Leggett, who is a care home manager on the Isle of Wight. She's decided, along with around 9 of her staff, to organise a lockdown in their care home. Nobody in, nobody out. That does seem to be the only way to protect care homes. Not 100% effective, but at least on a par with private individuals' households. Isn't that something that you could recommend, put into your guidelines? Of course, you can't force carers to do this, but perhaps create incentives or encourage them to do it?
Well, I think I would take my hat off to the carers in the UK, perhaps all over the world, that have been working to look after people with COVID-19, but particularly in this country where people have, as you say, locked in. So I take my hat off to those people that have done that, because it just shows how caring these individuals are. I think it's something that each care provider could look at. I myself have paid extra money and gave staff a pay rise for COVID-19 for dealing with that. It's a very extreme aspect, of course, asking people to stay locked in the care home. The challenge is how long might it be for, and how long could it last? Because you're asking an awful lot of people to do that, because many of them have got families themselves.
Mike Padgham, Chairman of the Independent Care Group, thank you very much for your contribution to the Nexus.
Thank you.
Now, in the UK, a nationwide lockdown has been in place since around March the 23rd, so households are not allowed to have visitors, with only a few exceptions. But with care homes, the rules are a bit different. Family and friends were asked not to visit residents around mid-March, but staff were and are allowed to come and go. So for care home residents, the most vulnerable in society, a full lockdown, the best protection, is not an option. Unless, of course, like our next guest, you take matters into your own hands. Claire Leggett is a care home manager in the Isle of Wight, and she and several of her staff have volunteered to stay constantly at their care home, no one in and no one out. Now, Claire, this is an extraordinary sacrifice and a great idea. Tell us how you came up with it. What were the circumstances?
Basically, I decided to lock the care home down because I'm really worried about COVID-19 coming into the home. So I decided to ask 9 of my staff members to move in.
And there isn't enough room for you all to have proper beds and bedrooms and so on. So what have you decided to do?
Yes, that's right. So we have some staff that are living in our second lounge in the care home. We have some staff that are actually pitching up outside in the garden that are living in tents as well, which is true dedication, which I'm completely grateful for, because we just don't have the staff facilities within the care home. I've got one staff member that's living in the office where I'm sat here now, and I'm up in the boiler room as well. So we are making do, basically, yeah.
It's quite a sacrifice, isn't it?
Yes, absolutely. It's a huge sacrifice for us to be here. It's massive. It means so much. So, you know, we can't pop to the shop or anything like that. We have to get everything delivered here.
And does that mean you're now confident that, to the best of your ability, you've protected yourselves and the residents from this rather nasty virus?
Yes, definitely. Yeah, I feel completely confident now that we've gone past the threshold. So yes, I'm confident that we don't have COVID-19. There's no one showing any signs or symptoms, staff or residents. So I feel happy that we've done the right thing and we've got no COVID-19 in the care home whatsoever.
You have built up relationships with your residents over months, perhaps even years. So what does this mean to them?
Yeah, it means an awful lot to them. We've got residents here that their age range goes right up to 103 years old. So I've got to know them over the years very well, as I have their relatives. So it means so much for us to move in, and they are really, really grateful. They're really concerned and just want to make sure that we're looked after as well. And I think it's just peace of mind for them knowing that we are here 24/7 caring for them to make sure that at the end of the day they're staying alive.
Do you think that other care homes should be doing this, and what would be your message to them? It is difficult.
Yeah, it is incredibly difficult. I didn't take this decision lightly, and I would try and say to other care homes that I think, you know, you can't take this decision lightly to lock down and make your staff live in. The staff are willingly, choosing to live in with me. But I think it depends on everyone's circumstances. But I just feel it's the only way that we're going to keep the COVID-19 out of the care homes. So I feel it's the only option we've got is to live in.
Well, Claire Leggett, care home manager on the Isle of Wight, thank you so much for your efforts, and I hope others are feeling inspired to do the same. I don't know if you remember Dame Esther Rantzen, Claire?
Yes, I do, yes.
Okay, well, stay with us, stay with this show, because later we're going to be hearing from the British TV star. We're going to be asking her what is going on with British society. But of course, this isn't just a problem here in the UK. Here are the estimates for deaths in care homes, both in North America and across Europe. In Canada, a staggering 79% of all COVID-19 deaths are thought to be in care homes. In the United States, it's estimated that more than a quarter of deaths are in care homes. But that's based on the states which report care home deaths, which is less than half of them altogether. And in Europe, the World Health Organization estimates that up to half of all coronavirus deaths across the continent are in care homes. Well, earlier we spoke to Shamina Di Lollo, a physician with Médecins Sans Frontières, or Doctors Without Borders. She's had many years dealing with emergencies, including the earthquake in Haiti and the famine in Niger. She's now working in Spain and Portugal to help manage efforts to look after the elderly in those countries. We asked her about the situation in Spain and what she's been doing to help.
The care home situation in Spain is really very fragile. It was weak at all before the epidemic, and now things they are not improving. As you may know, care homes in Spain are not hospital. They are completely out of the health system, and this situation didn't help to face such a big issue as COVID epidemic. Myself, I've been working with them, training people, and then my teams, they are doing that work. We also have been dealing with authorities. We were helping them to develop a crisis model that can be more adequate for such a response. Too many people have been dying alone, suffering without any support or barely any human contact, and I think that is something that that we need to reflect as human beings, and also as a society, why we are letting them down that way.
Okay, let's bring it back to the United Kingdom now, and I'm very fortunate to be joined by Dame Esther Rantzen. Not only is she one of Britain's best-loved TV stars and has been for decades, she's also the founder of a charity called the Silver Line, which is dedicated to helping elderly people, particularly to beat that feeling of isolation and loneliness and so on. Dame Esther, can you give me your perspective on what's going on here? Are the elderly second-class citizens in the United Kingdom and elsewhere?
Well, one of the sadnesses in Britain is that we don't have a minister, a government minister, whose focus is older people. And I've been campaigning for years that we ought to have one, because you've got to look at people of my generation holistically, not just as a problem when it comes to pensions or health or accommodation, but actually our whole lives, because I think what the virus has done is focused attention for perhaps the first time on the way older people are at the bottom of the national agenda and shouldn't be.
Is there something particularly wrong with Britain in that quite often people of your generation, they say to me, well, you know, in Europe, we see older people are much more integrated with the family. They'll see their grandchildren more often. They'll congregate in squares on a sunny afternoon. Are older people in this country detached from their families and society in a way that is more severe than other places in Europe?
I think that the ideal of being independent is something that older people very often cling to in Northern Europe, not just in Britain, but in Scandinavia too. And this has many advantages. It means that we can live in accommodation, hopefully, which is familiar to us and comfortable to us, and where younger people perhaps get more preoccupied with their careers and with bringing up their children. we older people can ideally involve ourselves in the things that occupy and interest us. But the downside of that independence is, as you say, that it's quite difficult to find time for us. You know, on the Civil Line helpline, we're hearing two B words. First one is busy. Everyone's so busy. Our children are so busy. Our neighbours are too busy to talk to us. The shopkeepers are too busy to make time for us. I don't want to make my daughter anxious, my son anxious, by telling them that I am feeling lonely, that I need their company, because I don't want to be a burden. And that is the other B word that I'm hearing so often from older people, that they feel that if they do talk about loneliness or isolation or the fears they have at the time of the virus, they will be a burden to those nearest to us, and they don't want that.
What would you like to see happen as a result of this experience with this awful pandemic?
Well, we have got a commissioner for children, it's quite right. We've got a minister for disabled people. We've got a minister for families. We need a minister for older people. And then we're going to have to look at the way we look after older people, because there is a problem with our care homes. What we do is collect together some of the most vulnerable older people, the ones who have frailties, have disabilities, perhaps have underlying illnesses, perhaps have dementia. And then when something like this horrible virus comes along, specifically targeting older people, it means that there's a terrible death toll. And I think we have to look at some of the lessons we've learned from this virus to see if there's a way we can be more effective at protecting older people in the future.
Of course, this crisis has brought out the best in some. We heard from Claire Leggett earlier, who has shut down, rather locked down, her care home with 9 of her staff. And that really shows that some people are willing to go the extra mile to help the elderly. It is to be commended, isn't it?
Well, I think the people who really work in this field, the caregivers, the doctors, the nurses, who really love older people and love their company and love looking after them and are beloved by them, are really terribly important, but have been neglected in the past. But I think this gives rise to the problem that people sometimes talk about, which is if someone in a care home falls ill with this virus, do we really want to cart them off to hospital where they may be on their own and they may die alone? Whereas in their care home, they're surrounded by people who know them and perhaps love them. So I think there are a lot of questions being thrown up by the way we're treating our older people. But I certainly think that people like Claire Leggett and her team are terrific and are not normally appreciated as they should be.
You're absolutely right. And there's one last human interest story I'd like to bring to your attention. And I know that, I feel you would have covered it back when you had that brilliant program, That's Life, in the 70s, 80s and 90s. And that's the story of Captain Tom Moore, the war veteran who's just turned 100. His efforts to raise money for the National Health Service with a sponsored walk capturing the world's attention. And he's now raised over $36 million. He is an incredible man, and he's done so well to inspire people at a time when a lot of people are feeling very, very tired and burdened by this pandemic. Dame Esther, I was just wondering, would you have covered him in your program? And if so, what aspects of the story would you have drawn out?
I think there are so many positive things about Captain Tom's story. In the first place, he's such a personality. He's so brave. He's so uncomplaining. He's so determined that he stands for a generation we owe a huge amount to. The ones who fought during the war, survived it, brought up a family, a remarkable personality. Secondly, the good news is that when he needed help from the NHS, because I believe he had a fall and he did himself quite a lot of damage, the hospital didn't think, well, you're 98, 99. I mean, you're not worth spending any money on, taking the trouble to patch up. They took enormous trouble to make him well again, to mend his bones again. And that, I think, is a very positive story. It's lovely that he's been so valued by the healthcare professionals. The third thing, I think, is that typically he's decided that he's going to pay back the good that he has received and try and do his best for them. And the public have responded in their hundreds of thousands, raising this enormous sum of money as he walks backwards and forwards in his garden. I think just shows that he has caught our imagination. So if there's one lesson that comes out of the Captain Tom story, it is we have to value older people, because Captain Tom has proved what treasures they are, what a fantastic resource they are, what role models they are for all of us.
You're absolutely right. So we would like to wish Captain Tom happy birthday. He's 100, and we would like to wish you a happy birthday for a few months' time when you turn 80. None of our viewers will believe that. But Dame Esther, thank you so much for your contribution to the Nexus. I really appreciate it.
And thank you. And regards to all your viewers, please stay safe.
That's very kind of you. Thank you. And thank you at home for watching. Remember, you can see this episode again or all our other episodes on the coronavirus on our channel on YouTube. Until next week then, goodbye.